What is Rh? Rh is an inherited protein that can develop on the surface of erythrocytes. What is an Rh incompatibility? It is a genetic hemolytic condition that can occur throughout the human gestation period. The pregnant mother's antibodies cross the placenta and target the fetus's erythrocytes. It's typically observed when there's an Rh negative mother and an Rh positive fetus. During the labor and delivery process of the pregnant mother's first child, there's a higher chance that the mother and baby's blood will mix. If this occurs, the mother's body may develop a sensitization or antibodies to the fetus's foreign antigens. As a result, it may trigger an immune response in future pregnancies. A previous abortion, miscarriage, or placental abruption can also result in the woman becoming sensitized. How is an Rh incompatibility diagnosed during pregnancy? Early diagnosis of an Rh sensitization is a critical factor in managing and preventing fetal complications. These are some tests that can help determine if the fetus is affected. The indirect Coombs test, amniocentesis, ultrasonography, and the Delta OD450 test. Patient education regarding Rh incompatibilities. For an unsensitized patient, we want to advocate in favor of preconception planning, such as genetic testing. An example of this would be a paternal zygosity test. We want to educate the patient on how to prevent sensitization in future pregnancies following the conception of their first Rh positive fetus. For an example, RHIG shot. We want to ensure the patient understands the RHIG shot needs to be administered for each pregnancy to be effective. We want to educate the patient on all aspects of sensitization and instill that becoming sensitized could jeopardize a future pregnancy, causing mild to severe complications and even a miscarriage or stillbirth. For a sensitized patient, we want to ensure the patient understands the blood group system, Rh factor, and pathophysiology behind the incompatibility. We want to educate the patient on the associated risks and potential complications that may occur. We want to emphasize the importance of diligent prenatal screening to the health of the fetus. We want to educate the expectant mother on possible interventions and treatment options. And we want to assist the patient in exploring their understanding of their high-risk pregnancy. Potential complications associated with Rh incompatibility. Here are some complications that may occur during pregnancy. Here are some complications that may occur after birth. Therapeutic management of Rh incompatibility complications. During pregnancy, we can do something called an intrauterine transfusion. This process is guided by ultrasound technology and entails infusing red blood cells into the umbilical vein of the fetus. We can induce labor depending on the degree of complications. The pregnant mother may require induction. This prevents further damage to the fetus. After birth, the newborn may require an exchange infusion, which entails removing the patient's blood and replacing it with donor blood. Phototherapy, which uses light therapy to break down excess bilirubin. Oxygen therapy, which ensures the newborn has adequate oxygenation. Intravenous fluids may also be administered if the newborn is hypotensive. Direct Coombs test, which detects antibodies on the actual surface of erythrocytes. Prevention of Rh incompatibility complications. The RHIG shot, otherwise known as RhoGAM or Winro, is a shot that is typically administered during pregnancy and after birth that inhibits the mother's production of Rh antibodies. This shot is only effective if the mother is not yet sensitized. It's typically administered around week 28 to 30 of gestation and 72 hours after live birth, miscarriage, abortion, or an invasive prenatal procedure. Nursing care for an affected newborn. If there's prenatal evidence of an Rh incompatibility, the nurse should remain vigilant and be able to recognize signs of jaundice in the newborn, provide continuous phototherapy, and obtain specimens for laboratory analysis, prepare for a potential exchange infusion, provide appropriate education to mother and family regarding ongoing interventions, provide the mother and family with emotional support as required. Under normal circumstances, the mother is not physically affected, therefore her postpartum nursing care proceeds as usual. Expected assessment findings in an affected newborn. Since the mother is not physically affected by the Rh incompatibility, her nursing assessments continue as usual. But for the newborn, we're going to observe for signs of jaundice, hypotonia or low muscle tone, lethargia, edema, pallor, tachycardia, and tachypnea.
All information was obtained from Keenan Lindsay et al. 2022, Perry's Maternal Child Nursing Care in Canada, 3rd edition.